Hello, Bio54. My name is Sophie Baylon, and today I'm going to talk to you about depression. First off, I'm going to talk a little bit about what exactly depression is in a general sense. So, depression is a mental illness that causes feelings of sadness, hopelessness, and worthlessness. But the difference between these feelings that you may feel every day and the feelings that you feel in depression is the feelings are so intense and so extreme that they can affect your daily life and how you function. There are two different types of depression. There's major depression and persistent depression. So now I'm going to talk a little bit about the two different types of depression that I've had talked about earlier. The first one is major depression, which is categorized by intense feelings of sadness, hopelessness, and worthlessness that conflict with your daily life. And this depression tends to occur in a single event, so just once in a single period of time or several times, but it's usually not an ongoing thing. The next type of depression is persistent depression, which, unlike major depression, lasts for a much longer time to be able to be categorized as persistent depression. So, this depression has the same feelings of major depression but must last for a duration of 2 years. And the symptoms of this type of depression can vary. They can be quite severe, or they can also can just come on very slightly. Besides those two types, there are also 3 other categories of different types of depression that can be felt within major depression and persistent depression. The first one would be psychotic depression, which causes hallucinations and delusions along with these intense feelings of sadness. And the cause of this type of depression is usually unknown, but it tends to run in the family. So if you have family members that had psychotic depression, you may also experience this if you were to get depression yourself. The next is postpartum depression, which can occur because of physical or hormonal changes, which is why it's most prevalent in women, because this type of depression tends to happen to women who've just had a child, and they will get sad after the birth is over. The last type of depression that I'm going to talk about is seasonal depression, and it's very straightforward. This type of depression happens during the winter season because of a lack of sunlight. So, a typical treatment for this type of depression is having a sun lamp. And this, as you would think, is a type of depression that happens a lot in very not sunny places. So, alright, so now I'm going to talk about the symptoms of depression that are used to tell if somebody does have this mental illness. So, the general symptoms of depression are intense feelings of sadness, hopelessness and worthlessness, having more anxiety or fear, feeling very uneasy. What tends to happen because of these feelings is there's a loss of interest in things that were once pleasurable and once made you happy, and this can also decrease a person's sex drive. You may have a lot of fatigue and can find it hard to concentrate, which will in turn make it hard to remember things and also make big decisions. Things that can happen as well as someone could either start to sleep more or sleep less depending on how they are reacting to this new depression. And also because of this kind of ties along with the sleep is people can increase their food take, maybe if it makes them feel better, or decrease their food take because the sadness can make it hard to eat. When these feelings get very severe, people tend to have a lot of suicidal thoughts, which can be very dangerous. And although everything I've said so far, besides the fatigue, most of these feelings are psychological, but it can also cause physical pain. Many people may have aches in their bodies and a lot of headaches, and their digestion may change because of their sadness. So things like constipation or things like that can also occur. So what exactly does cause depression? Well, there's a lot of different things that do cause depression, and in general, it's been seen that people's brain chemistry can actually be different if they have depression, although that's not usually something used to diagnose depression, it is something that's seen. Having a family history of depression can also cause it, and most often it's because someone has experienced a traumatic event or is having an increased amount of stress in their life, and sometimes depression just can come on for reasons unknown. In women and children, there's two more specific reasons as to why depression can occur. In women, it could can be because of hormonal changes, such as starting your menstruation, pregnancy, or menopause. As I said earlier, there's postpartum depression, which is caused after a woman has birth, and also it can happen during pregnancy. And in children during puberty, girls and boys are equally as likely to have depression. So puberty can be one reason, which is also tied into hormonal changes as to why they may be experiencing depression. So once you do have depression, there's a lot of different ways to treat it, and a lot of people know the usual ways, which is medication or therapy. So first I'm going to talk about the medication that's used. The pills that people take for depression are called antidepressants, and they regulate your neurotransmitters, which, as you can see, are serotonin, dopamine, and norepinephrine. So these are transmitters that regulate your mood. So you either have SSRIs, such as Prozac, or you have SNRIs, such as Cymbalta, which both of these you might have heard of before. So these are usually used. And these medications tend to be used along with psychotherapy, which is considered talk therapy. And you have two different types. You have cognitive behavioral therapy and interpersonal therapy. So first, CBT, which is cognitive behavioral therapy, is meant to change the thought process to stop people from the negative thoughts that come with depression, and to change their views on the environment and see how their behavior is maybe causing their depression. The second type, interpersonal therapy, is the purpose to work through problems in a relationship causing depression. So that has to do with relationships. The second type is managed care, and this one's pretty simple actually. It's just kind of changing the way that the patients are receiving treatment. So the goal is to put most effort where it's needed and take some effort away where it's not needed. So say that this patient needs more therapy, then we'll give more therapy to this patient, and this patient needs maybe a better medication, then we'll put more effort into that. And the whole purpose of this is to increase the productivity of how the patients are being treated, because depression can be a very costly illness to have because of the medication, and the therapy is very expensive. The last type that I'm going to talk about is placebos, which have been begun to talk a lot in the last 20 years or so. And so placebos are fake pills, basically. They're used in place of the antidepressants to keep people from taking antidepressants and taking a lot of medication. So these pills have the same effectiveness as the depressants, which has been seen in trials that they work the same, but they don't have the bad side effects. The patient is told that they'll be used, but they don't know when they'll be used. And of course, therapy is also used along with this medication. And the purpose is to shift away from having a reliance on medication. So the last thing I'm going to talk about a little bit is antidepressants in use of children. So the main antidepressant used by them is fluoxetine, which I talked about earlier. That's Prozac, and it increases serotonin levels. So as of now, there really is no evidence showing if this is actually the most effective way to treat children with depression. So that is one reason why this is coming under scrutiny a little bit of using these methods to treat kids. Also, one thing that is a con about using these antidepressants is that they don't actually work right away. So you have a delayed time in which the feelings of depression can become much more intense, which can increase suicidal thoughts or harm that the person may take on themselves because of their depression. So that doesn't really help the reason that it's for. also, the brain of children is very malleable at this point in their lives. It can be changed really easily, and by implementing these methods of using these antidepressants can, in the long run, change the way that their brain functions, which is very bad, obviously, because it will change the way that that they they function with their emotions. And the next thing that I'll talk about is just using the drugs in general creates an emotional crutch for the children using these, because they see the pills as the way to treat their illness. They don't learn how to change their behavior, change how they control their emotions. So it ends up becoming more of a reliance and not so much as an educative way to change the depression. It is more just keeping the depression at bay than learning how to get rid of it. The last thing is, these antidepressants tend to enhance someone's emotions, and if you are depressed, as I said before, the feelings are very intense. So by enhancing these emotions can be very dangerous, and which can lead to increased suicidal thought, increased sadness and worthlessness, these things that can make you potentially harm yourself or harm others. So because of all these things that I have just said, the use of antidepressants is being rethought at the moment for adolescents, just to see what is the most safe and most efficient.